If you are a type 2 diabetic, or you are close to someone, or you take care of someone who has type 2 diabetes, then you're going to want to listen up to this video, because in this video I'm going to answer 5 uncommon questions about type 2 diabetes. So stay tuned. Before I get into it, for those of you meeting me for the first time, I am Dr. Amina Goodwin. I'm a physician and a health coach, and I help you to figure out how to eat better so that you can feel better and get on with life without having to be bogged down by the healthcare system. All right, so last week I posted a video about 5 questions you should ask your healthcare provider if you are just getting diagnosed with type 2 diabetes, right? Now, today, this video is going to be just 5 questions in general, 5 unusual things that you may be thinking, maybe wondering, maybe you don't know how to ask them. I'm going to answer those 5 unusual questions, right? So let's get into it. Question number 1. What unusual symptoms beside the common ones should I look out for with diabetes? So the common symptoms people know about: thirst, going to the bathroom a lot, passing a lot of urine, and so on, and tiredness and so on, right? But one of the symptoms that you might overlook, or you might not think it's related to type 2 diabetes, is recurring skin infections. These are mild skin infections, particularly fungal skin infections. The thing about fungus is that the fungal organisms, yeast organisms, they love sugar. So if the body is sweet, you're going to have overgrowth of fungus. And so what you might see, which a lot of people will dismiss as dry skin, but a lot of times you can have these dry patches on the face, and they would especially be in the hair bearing areas, the eyebrows, and for men in the beard. Okay, you'll also see a rash. Sometimes it's more of a pale rash, like you're losing the pigment in the creases of the nose, and sometimes you might see these pale patches around the mouth and on the cheek as well, right? So essentially just recurring skin infections, but particularly fungal skin infections you might see on the face, around the ears even, and that might be something that is telling you that maybe your sugar is a bit high, or maybe the immune system is a little off. Another thing as well is that you might see fungal infections in the body creases, especially if there's a lot of sweating and so on, so under the breast, in the groin creases, buttocks, and so on and so forth. And then of course for men and women, women, genital yeast infections, women know about those things, but men can also have genital yeast infections. It's called balanitis. If you're a man, you can look that up, but genital yeast infections in both men and women. And then another one that's pretty, even more overlooked, is when you have just bumps scattered on the skin that tend to take a long time to heal, right? We call that prurigo nodularis. So if you get like bug bites, or just sometimes just little bumps pop up and they tend to itch a little bit, that's where the word prurigo comes from. And then you scratch them and then they get a little raw, and then they just take forever to heal. And then when they heal, oftentimes they'll heal with darkening of the skin, right? So prurigo nodularis is another thing that can be seen a little more commonly in people who have type 2 diabetes. And then the last thing about the skin conditions is just slow healing in general. That's a feature of type 2 diabetes. Now, second question that uncommon question that you might be thinking or asking, or I'll ask it for you is, are there any unusual dietary recommendations, right? Anything related to specific foods that can have a surprisingly positive impact on your blood sugar control? And so, you might be shocked about this one, but this essentially is the fact that fat, naturally containing fat in foods, or naturally fatty foods, may be healthier for you than you might realize. So one of the commonest bits of advice out there for anybody seeing a doctor in general, anybody who happens to be a little overweight, and certainly for diabetics, is stay away from fat, stay away from fatty foods. Don't eat low fat everything, right? But surprisingly, naturally occurring fatty foods, naturally containing fat in foods, actually helps to modulate the blood sugar after a meal. So if you're consuming a meal that has things like avocado and olive oil, olives, if you use butter, if you're having your coffee with whole milk or half and half, incorporating naturally occurring fat with your food is going to slow down the absorption of whatever carbohydrate you have in your food so that you have a slower release of glucose into your system. And because it's slower, it means your body has a chance to produce insulin to metabolize that glucose, so you don't have the glucose levels going up way high and negatively impacting your body, right? So fatty foods, specifically naturally fatty foods, have a surprisingly beneficial effect on blood sugar levels. I'm not talking about unnatural, like, fats like deep fried foods and things that are like trans fats and things like that. Those are pro-inflammatory and those cause their own set of problems. I'm just talking about naturally fatty foods. When I was in medical school, actually, we were taught to tell people with cholesterol, diabetes, whatever, we were used to tell them, don't eat avocado, don't eat coconuts, beware of nuts because they're fatty. But now we know that once it's naturally occurring, it's in the food as it was produced by nature, that is going to be beneficial to you and overall help with your metabolism and even help to moderate your weight, okay? Third question is that, you might ask, are there any environmental factors, right, that could impact you as a diabetic? Now, over the past week or two, I saw at least 3 different articles where they're talking about the negative impact of climate change on health, right? Suddenly climate change is being blamed for everything, right? Including some very, in my opinion, strange health conditions, right? But, okay, I'm not saying that maybe it's not hot. I don't know if that's a cycle we're in where it's quite hot, but certainly excess heat can negatively impact diabetics, especially because a lot of diabetics are on a medicine. It's in the class of, we say ACE inhibitors. It's a type of blood pressure medicine which many diabetics are on because it's felt to be protective to the kidneys. But the thing about that medicine is that it negatively impacts our ability to listen to the thirst response. So if it's excessively hot, but your thirst centers don't work well, your brain does not get the proper stimulation to say, okay, go and drink some water, then you can get dehydrated and not know to tell yourself to drink something. And if you're on this medicine, which most diabetics are on, and you get dehydrated, your chance of running into problems is much, much higher than somebody who is not on that medicine. And we've seen time and time again in the hospital, a little acute illness, a little bout of gastroenteritis, or even some people who might be out in the sun for the day and they can come in with acute kidney failure because they were on this medicine and it impacted or hindered their ability to pay attention and respond to a sensation of thirst and go and drink water, right? So that's one thing I would say. I personally don't think climate change per se is causing these diseases, but I think because now in the world, so many people are on so many medications which interfere with the body's natural reflexes and responses, it's making us run into problems, okay? Fourth question to ask about diabetes, right? You might be wondering is, how does diabetes impact the mouth or oral health? And certainly having diabetes, especially if it's uncontrolled, is associated with a higher chance of gum disease, gingivitis, periodontitis. And that's a potentially serious problem because if you have gum disease, it means that you have a higher concentration of bacteria in the mouth. It's normal to have bacteria in the mouth, but if you're having a high concentration of bacteria in the mouth, it means that during sleep, you could potentially aspirate. Some of that bacteria can get down and it can get into your lungs and increase your chance for getting pneumonia. And we've seen diabetics come in with serious types of pneumonia where they have actual abscesses in the lungs and it's associated with quite significant gum disease. So as a diabetic, you don't want to forget to go to the dentist and sort your teeth and your oral health out, because having diabetes at the same time as gum disease is going to increase your risk for problems, particularly pneumonia, bad types of pneumonia, okay? And then the last thing that you might ask is, I have diabetes. Is there any particular supplement I should consider taking, a vitamin supplement, whatever, right? Now, generally, I'm not a big fan of supplements. My husband likes to fuss with me, oh, you need to take your vitamins, right? But, I try to get my vitamins as much as possible from food, and then every now and then I take it. But the one vitamin that I do believe we could all stand to take a little more of, or most of us, is vitamin D. Now, it is a known fact that the degree of or prevalence of vitamin D deficiency is extremely high, and it's even higher in Black people. Okay, so if it's one vitamin that I generally recommend people to take, now I'm not giving medical advice, but I'm just saying in general, right? You can ask your doctor. It would be vitamin D. We know that people who are vitamin D deficient have worse outcomes for many things, infections being one. Of course, many of you might have heard the news where during the pandemic, the people who had vitamin D deficiency were more likely to be on the ventilator and so on and so forth, right? So a vitamin D is one vitamin that I think is a good thing to take. You can ask your doctor about it. You can probably get your levels, ask your doctor to get your levels checked. Now, it is possible to overdose on vitamin D, which is why I'm saying seek attention from a doctor and sort of make sure that, depending on your situation, that you might not be prone to being overdosed, and you can get a level checked and then you can monitor it intermittently, right? So those are 5 questions, unusual questions, things that you might not necessarily think about, or you might not know how to put them in words, but you have type 2 diabetes and you're like still a little overwhelmed. And so just to summarize the questions again, are there any unusual symptoms, right, beyond the common ones that I should look out for? 2, are there any unusual or surprisingly significant dietary changes that you can make that affect your diabetes? 3, are there any environmental factors that you may want to consider that could affect your type 2 diabetes? 4, is there a correlation between type 2 diabetes and oral health? And then lastly, 5, are there any specific vitamin supplements that you should take now that you know that you're type 2 diabetic? If you found this helpful, definitely go ahead and like the video, also subscribe to the channel. Interactions like that actually help the video to be shown to other people. And obviously, for people who may benefit from this video, we want them to see it. So thanks again for watching, and I am wishing you continued good health. Bye-bye.